thank you for your time. I definitely want to talk to you about telehealth. The first question I want to ask you, though, has to do with your image right now. There's this video being shared on social of your interview on Fox News the other day. People are saying you were dodging the question of whether or not there are enough ventilators in the United States. Can you address that right now?
Sure. I think the main point that I want to get across is that we're doing everything that we can to mitigate the spread of the virus so that we don't put our healthcare system under strain. The reality is there are ventilators in our backup supply. And what I wanted to focus on that day was to make sure that people understand that our main focus right now is prevention so that we don't put that healthcare system under strain. We do have an emergency stockpile. There are existing, thousands of ventilators that are in that stockpile. And the president's been working with other manufacturers as well to increase that supply.
To increase the production. Okay, great. I also wanted to ask about whether or not the administration, your agency in particular, is taking steps to enforce social distancing among your employees. I've been hearing from a lot of federal workers that these guidelines are not being adhered to by a number of federal agencies. What are you doing specifically in your agency?
Well, much of our agency has gone to telework. We just had conversations today, even in the meetings that we do have for the remaining workforce, that we need to make sure that we don't have too many people in the room. We need to abide by the president's directive. They put out guidance yesterday that is supposed to impact every single American, 15 days to slow the spread. As part of that, we're making sure the meetings that we do have to have, that there's not more than 10 people inside the room, but a lot of the CMS staff are going to telework.
So you can confirm anyone at your agency who would be considered quote-unquote non-essential is not having to come in?
So what we've told people is that, first of all, even a week ago, when all of this stuff started, a couple weeks ago, if anybody feels vulnerable in any way, they've had any type of exposure, or if their health is compromised in some way, they shouldn't take the risk. And we were fine with them working at home and basically doing their work remotely. Since the increase that we've heard in the standards that have been put out by OMB and by the federal government, now we're saying we're even moving to more telework. So we've had employees come in, get the equipment that they need, but essentially we're leaving it to the managers to make that determination. But we're encouraging as much telework as possible because that's consistent with what the president has said around all of the measures that he wants every American to take, 15 days to slow the spread.
Right. Get everyone's job done, but stay at home if you can.
That's exactly it.
Okay. So about the telehealth initiative, what is the overriding message that you can give to folks? I mean, we don't just talk to folks here in D.C. with our station, people around the country. What's the number one thing you want them to know about this new telehealth initiative?
Well, the president put out guidelines, right? 15 days to slow the spread. It was measures that every single American can take. And in that, we told people you should try to stay home. And so if you look at the Medicare program, there are people that are ill. And if they need health care services, we don't want to force them to have to come to get their health care. By allowing for broad-based telehealth services in the Medicare program, we can allow people that may not have any symptoms to do with coronavirus. Maybe it's a diabetic, somebody with heart disease, they need to check in with their doctor, and now they can do that remotely. That means they don't have to travel. That means they don't have to sit in a crowded waiting room and potentially being exposed. Also, for people that are showing some symptoms, they can communicate with their doctor and make that determination about what the next steps are. But again, it avoids them having to travel and them potentially infecting more people.
Last question. Anyone who is technologically deficient, so to speak, how should what's the message we can get that you want to give to them about how they can communicate with their doctor? What number do they call? Where can they get information?
Sure. So any of our Medicare recipients can always call our 1-800 number to get more information. But what we're hoping is that, as part of the president's recommendation, 15 days to slow the spread, all of the things that we need to do, washing our hands, staying inside, reducing crowds of 10. Also help your fellow neighbors. If you have somebody in your neighborhood or a family member and they do need medical services, help them, right? Bring your computer, bring your phone, and allow them to receive services inside their home so that we can protect our vulnerable Americans.
That's a great point. Two-shot real quick. Are you getting everything you need from the president?
Yeah, the president's been great. He's done a wonderful job listening to what the scientists are saying and the policy recommendations and taking decisive action.
Okay, wonderful. Thank you so much for your time. I appreciate it.